dentures are really difficult. If you think, when I do a filling, there'll be a patient in the chair with a tooth, and that's important, and I'll be filling that tooth. And that's me putting the filling in the patient's tooth. Now, with a denture, it's not just a simple case of I can go over to a box, I can open the box up, pull out denture, A, and you open your mouth, and I go, there you go, that's yours. So there's all different stages in making dentures, and there are loads and loads of different dentures to make. So, you've got, if I sort of cut it down as quickly as possible and as simply as possible, you have plastic dentures, which are kind of all plastic dentures that replace all of your teeth. So I'm just passing you that one there. So that's a full denture. That's a full acrylic denture.
And I remember my dad having something like these.
Right. Yeah. So a lot of people hopefully not anymore, but years and years ago, for your 21st birthday or your sort of 25th, 30th birthday, you got a set of teeth.
You know what? I was going to ask you that very question. Is that that's true then?
No, that's true. Yeah, they would literally pull out all
your teeth.
And then in they went. There was a theory called the focal infection theory, where they assumed that infections in the body were related to the teeth. So if you pulled out all the teeth, the gums would heal up, and so there were no communication sites. There was no way that infection could get from your teeth into your bloodstream, and everything was sealed. But of course, it meant, unfortunately, that the teeth were pulled out. Now, you need teeth to speak, you need teeth to chew, you need teeth to smile. If you see these sort of gurning competitions where they've got no teeth and the whole face is shrunk in. And the problem is, teeth support bone. So the bone holds the teeth in place, but if I take a tooth out, that bone isn't needed anymore. So gradually what happens is the bone kind of collapses and shrinks. So if you take someone's teeth out, initially they've got face shape, but after a while, the gums shrink because the bone isn't there and the face caves in. So they get that sunken, older appearance. So teeth are important to support bone. Now, bone is important with a denture because bone supports the denture as well as the teeth. So you've got that's a full acrylic denture there. So that's replacing all of that patient's upper teeth. You also have what we call partials. So the one I've got in my hand there,
right,
I'll swap over.
There you go.
That one is missing a few teeth, but it's got a few teeth on.
Yep, I've seen this sort of thing as well.
That's the sort of thing, heaven forbid, you're not wearing your gum shield when you're playing rugby, and you get a blow to the chin, and it breaks or it knocks out one of your teeth. So you've now got a gap. Now, obviously, when you've got a missing tooth, you can fill a gap with a bridge, a denture, an implant, but in the short term, that's been knocked out. So there's an area of trauma there, there's an area of damage, and we want to get something in that space quickly to fill the space so you haven't got a missing tooth, but you don't want the other teeth either side sort of moving into the space. So we might make you what we call an immediate denture. Now, an immediate denture will be made of acrylic, and we'll do all the sort of procedures for dentures are the same. You'll go in, you'll sit in the chair, the dentist will mix up, or his nurse might mix up some alginate. That's put into the patient's mouth. That gives us a model of your mouth. So that's one of the models there, and I'm just pulling that just to get that other denture off. So there's a plaster of Paris model of your teeth. That is then sent off to the dental lab, and they will make me a model, and they will then design a sort of denture. I might add to that design and tweak that design a little bit, and then we'll get back a wax sort of denture. So this thing here is just a piece of wax that's in the shape of a denture. Okay. If you feel that's dental wax.
Okay, so that's right. I'm with you.
And what I'll do is, the reason why we get a wax model like that is I'll get you to bite into that. So what I'm actually trying to do is I want to know how your top and bottom teeth bite together. So if we're assuming, say, that you're missing a couple of teeth because you've had an accident, so the lab will have some wax in that denture shape. I'll melt that, warm it up, and I'll say to you, right, bite together for me. And you bite together, and that then gives me a registration or a record of how a patient bites together. That then goes off to the lab, and then they can make the denture and the denture teeth fit the gap in the right way. So dentures, really complicated, and to make them look really good, you need quite a good dentist, but you need a really good technician.
I was thinking that, so it is a specialist job to actually make.
Yeah, for the dentist, you can get specialist dentists that do that, but the technician, the lab tech himself, a lot of guys, all they do is they just do denture work, and I use a guy, Rob, up in Ramsey at Abbey Dental. brilliant. I mean, I've worked with him, at Liverpool when I was just a student. So I always say, I don't work. So Rob doesn't work for me. Rob works with me, and I can communicate with him. So if a patient comes in and says, "Well, when I was young, I had gaps between my teeth, and actually, I'd like to have some gaps in the denture teeth," so I can sort of say to my technician, I can say to Rob, "Look, Rob, can we move this a little bit? Can we tweak this tooth? Can we just bring this one round?" Or the patient would like slightly longer teeth, or the patient would like slightly shorter teeth. And you're trying to get them as natural as possible, because nobody wants to smile and people kind of go, "He's got false teeth." Again, it's the same with crowns, it's the same with bridges, the same with implants. You're trying to hide it. You're trying to make it look natural. You don't want people to sort of look and see that they've got something artificial in there. And if you think about it, the number of times you can be at a party and someone says, "I've just got new teeth," or "I've just got a new bridge," and they'll smile and show off their new crowns or their new veneers. Nobody takes their denture out and goes, "What do you think of my new denture?" They just don't do it. But a denture has got so many different bits and so many parts that you've got to tweak and work on. It's a lot more complicated to make a denture than it can be just to put a filling in.
So do you actually see as many people needing dentures now? Because presumably it seems to me that my dad, who died a few years ago, I know he had a full set of dentures. My mum, bless her, is in her 90s, so she still has some of her own teeth, and I think has partial ones in.
Right.
But now it seems to me, people maybe my generation and the generations behind me, there's so much better dental care. People are far more inclined to take care of the teeth. Thank heavens we're not inclined to take all our teeth at 21, and people are keeping, I'm assuming, keeping all of their own teeth for much longer.
Yeah, as long as possible. I mean, for us, I always think if I take a tooth out, I've failed. And I can take that personally. You get quite a few dentists that take that personally. It's, you want to try and do as much as you possibly can to keep a tooth, partly because it's the patient's natural tooth, partly because it's preserving the bone, and that bone might be useful for something later on. But when you take a tooth out, that's it. You ain't going to put that tooth back in again. It's gone. So then you've got to think, right, how am I now filling that gap, assuming the patient wants to fill the gap? You've also got to be realistic, though. If you've got a cracked tooth or a split in a tooth or a tooth that isn't restorable, you don't want to constantly keep, well, we'll try this or we'll try that. There is an end point where you cannot save something. But, yeah, they're more aware that they want to keep their teeth. I don't think people want to hear that kind of chink of plastic hitting a glass at the end of the evening. So again, and people know dentures. If you think about it, just looking at I've got the full upper in my hand. That has to kind of suck against the roof of your mouth. That's got a suction effect to hold it there, and that's not great. That's kind of relying on a piece of plastic sticking to the roof of your mouth. So the longer that people can keep their teeth and don't need bits of plastic, hopefully you never need it. That's great. Our job is when they do need something like that, because as I say, accidents are the sort of things. If you get a tooth knocked out or you have an accident and a tooth does need to come out, that's where we've got to think in the short term. Are we going to put a temporary bridge in, or are we just going to go, what's quick? And we can get one of these, a little immediate denture turned round in a couple of days. It's literally impressions, off to the lab will turn it round, and then we've got the tooth back. It's not ideal, and we might need to change that. We might need to do more impressions. We might need to do a better denture a bit later on, but at least we've got something there. If people can hang on to their teeth, that's the important thing.